Dementia is a broad term, and it includes a lot of different brain pathologies. The sort of top three are Alzheimer's disease, vascular disease, and Parkinson's disease, or Parkinson's pathologies that lead to dementia. So what we like to call, what we call of dementia is just as general syndrome. That means you have impairment in two or more domains of thinking, such as memory and language, attention, visual perception, okay, and some impairment in function, okay, such as balancing the checkbook, driving the car, okay. Those are what qualify for a dementia. However, the type of dementia is where we give it the name. So Alzheimer's disease is a type of dementia, and it is generally certainly the most common brain pathology associated with dementia. Until about 5 to 10 years ago, the only way to make the diagnosis for sure of Alzheimer's disease was to do a brain autopsy. Nowadays, scientists have developed tools in which we can look at the brain during life to look at the basic proteins that are involved in Alzheimer's disease. And there are two of them. It's the amyloid of the A-beta amyloid and the tau, abnormal tau protein. And so there are now two specific PET measures that we can use for amyloid imaging and tau imaging. And the amyloid imaging we hope will be available for clinical use in the next 3 to 5 years. So this allows us to look in people over time without having to be invasive. Before this time, as I said, we needed the autopsy, or there were some fluid measures that we get from the CSF, A-beta and tau, but it was more invasive. This is fairly straightforward, although it does involve a small amount of radiation. What it does is it documents the presence or the absence of the two proteins that are related to Alzheimer's disease, the amyloid protein and the tau, abnormal tau. You can have the presence of the amyloid protein and even small amounts of the tau protein and be completely normal. It does not diagnose a dementia. A dementia is a clinical syndrome. What these tools give us is the presence of the abnormal protein. I kind of want to liken it to something like knowing that your blood pressure is elevated before you have a heart attack, or your cholesterol is elevated before you have a heart attack. I look at it that way, is that it doesn't mean you're going to develop the syndrome of dementia or be impaired, but what it does mean is that you've got some of the pathological features, and by definition, you're at higher risk. It's been studied extensively, and there are 3 FDA-approved compounds, or what we call ligands. However, it's not covered by insurance. So what there is happening, though, is the Center for Medicaid and Medicare Services is performing a very large study on 18,500 people to look at the diagnostic utility of amyloid imaging in dementia. It started early this year. It's going to go on for about 3 years. And the hope is that it will prove the utility of this, and then Medicare will reimburse for it. And then, of course, more other insurance companies will pick up reimbursement.